This is Chapter 10, Question 2. The gracilis is palpated through a thin superficial tendon on the anteromedial thigh with knee flexion and resisted adduction just posterior to the adductor longus and the medial to the semitenosis. The sartorius is located approximately just medial to the tensor fascia latae and lateral to the iliopsis. You palpate superficially from the anterior superior iliac spine to the medial tibial condyle during a combined resistance of hip flexion, external rotation, abduction, and knee flexion in a supine position. The biceps femoris is palpated posterolateral aspect of the distal thigh with a combined knee flexion against resistance just distal to the ischial tuberosity in a prone position with hip internally rotated during active knee flexion. The semitenosis is posteromedial aspect of the distal thigh with a combined knee flexion and internal rotation against the resistance just distal to the ischial tuberosity in a prone position with hip internally rotated during active knee flexion. The semimembranosus is largely covered by other muscles, and the tendon can be felt at the posteromedial aspect of the knee just deep to the semitenosis tendon and combined knee flexion and internal rotation against the resistance. The rectus femoris is straight down the anterior thigh from the anterior inferior iliac spine to the patella with resisted hip flexion/knee extension. And the vastus lateralis is slightly distal to a greater trochanter down the anterolateral aspect of the thigh to the superolateral patella with extension of the knee, particularly full extension against resistance. The vastus internal medius is the anteromedial distal 1/3 of the thigh just above the supraomedial patella and deep to the rectus femoris with extension of the knee, particularly full extension against resistance. And the vastus medialis is the anterior medial side of the thigh just above the supraomedial patella with extension of the knee, particularly full extension against resistance. And the last one is the popliteus, and with the subject sitting, the knee is flexed at 90 degrees and palpated deep to the gastrocnemius medially on the posterior proximal tibia and proceeded supralateral toward the lateral epicondyle of the tibia just deep to the fibular collateral ligament while the subject internally rotates the knee.